Cancer treatment is notoriously expensive, and the reasons behind these high costs are rooted in a complex combination of scientific innovation, economic dynamics, regulatory frameworks, and healthcare system inefficiencies. At its core, cancer is not a single disease, but a vast category of illnesses characterized by abnormal and uncontrolled cell growth. There are over 200 different types of cancer, each with its own behavior, genetic profile, and required course of treatment. This diversity makes the development of effective treatments not only scientifically difficult, but also incredibly resource-intensive. Each cancer subtype might respond differently to drugs, necessitating personalized approaches and targeted therapies, which further complicates treatment protocols and adds to the overall cost. One of the most frequently cited reasons for the high cost of cancer treatment is the immense expense involved in research and development. Bringing a single cancer drug from discovery through clinical trials and into the market can take well over a decade and often costs upwards of $1 to $2 billion. The process is fraught with risk. Only a small percentage of potential drugs ever pass all 3 phases of clinical trials. This means that the few drugs that succeed must bear the financial burden of all the failed attempts. Pharmaceutical companies often justify high prices by pointing to the cost of this research pipeline, arguing that without these returns, future innovation would be stifled. While that argument is not without merit, critics argue that prices are often set based not just on cost recovery, but on what the market will tolerate. Cancer treatments themselves have become increasingly sophisticated. Traditional treatments such as chemotherapy and radiation are still widely used. But newer methods like immunotherapy, targeted therapy, and CAR T-cell therapy have entered the field. These newer modalities are the product of cutting-edge science, some of which involve altering a patient's own immune cells to attack cancer, and they are often custom-made for the individual. For example, CAR T therapy requires extracting T cells from a patient, genetically modifying them in a lab, multiplying them, and then reintroducing them into the body. This kind of therapy not only demands specialized facilities and highly trained personnel, but also a logistical framework that adds layers of complexity and cost. Moreover, precision medicine, which tailors treatment based on a patient's genetic makeup and the specific mutations of their cancer, has improved outcomes in many cases, but requires expensive diagnostic tools like whole genome sequencing, which can cost several $1,000s per test. Beyond the science, the healthcare system itself plays a significant role in cost escalation, especially in the United States. Unlike countries with centralized healthcare systems that can negotiate drug prices on behalf of the entire population, the U.S. allows pharmaceutical companies to set their own prices with relatively little oversight. Medicare, for instance, has historically been prohibited from negotiating prices directly with drug manufacturers, though recent legislative efforts have started to challenge this model. As a result, drug prices in the U.S. are often significantly higher than in other developed nations. For the exact same medication, hospitals and clinics also contribute to the problem. The billing process is opaque, often including facility fees, administrative charges, and significant markups on drugs and procedures. For instance, the cost of administering a chemotherapy drug in a hospital can be many times higher than in an outpatient clinic, not because the drug itself is different, but due to the overhead associated with hospital operations. Another factor driving costs is the long-term nature of cancer treatment. Many cancers require a series of treatments that span months or even years. A typical cancer journey might include surgery, multiple rounds of chemotherapy or radiation, ongoing diagnostic scans, and follow-up care, including maintenance therapy that could continue for life. Each step involves multiple medical professionals: oncologists, radiologists, pathologists, surgeons, and nurses, as well as specialized equipment and facilities. In many cases, treatment plans need to be adjusted over time, particularly if the cancer is resistant to initial therapies or returns after a period of remission. These adjustments may include switching to more expensive second-line or third-line treatments, which are often less studied and therefore priced even higher. Moreover, cancer patients frequently require supportive care to manage the side effects of treatment. This might include medications to address pain, nausea, fatigue, and infections, as well as mental health support and rehabilitation services. These costs are often underappreciated, but can add substantially to the total financial burden. In many cases, patients also lose income due to time away from work or reduced working capacity, further compounding the economic strain on individuals and families. The issue of limited competition also exacerbates costs. Many cancer drugs are protected by patents for years, and companies often use legal tactics to extend exclusivity periods, delaying the introduction of cheaper, generic, or biosimilar versions. When generics do enter the market, the price drop is often less steep than in other drug categories, particularly for complex biologics. In situations where there is no direct competitor, manufacturers can continue raising prices year after year, even after the drug has been on the market for some time. There is also the problem of orphan cancer's rare types that affect small populations. Because the potential market is so small, companies often charge higher prices to make the endeavor financially viable. Globally, the cost of cancer care varies dramatically. Countries with publicly funded healthcare systems, like those in Europe and Canada, typically have lower treatment costs due to price negotiations and centralized purchasing. In contrast, patients in the U.S. may face six-figure bills, even with insurance. Insurance policies vary widely in what they cover, and out-of-pocket costs, including deductibles, copays, and uncovered treatments can be financially devastating. Some patients resort to crowdfunding or loans, while others skip treatments altogether due to cost concerns, which can lead to worse health outcomes and even higher long-term expenses. In recent years, some efforts have been made to control these spiraling costs. Value-based pricing, in which a drug's price is tied to its effectiveness, is gaining traction in some parts of the world. There are also initiatives to streamline the drug approval process without compromising safety, which could reduce development costs. Additionally, nonprofit organizations and patient advocacy groups often provide financial assistance, support navigating insurance, and access to clinical trials that may offer promising treatments at no cost. However, these solutions are patchwork and not available to everyone. In conclusion, the high cost of cancer treatment stems from a perfect storm of factors: the complexity and individuality of the disease, the cost and time of drug development, the cutting-edge nature of modern therapies, inefficiencies in the healthcare delivery system, and a pricing environment that lacks sufficient checks and balances. While progress in cancer care has undoubtedly saved lives and improved outcomes, the financial burden it imposes on patients and society remains a significant challenge. Addressing this issue will require coordinated action across the pharmaceutical industry, healthcare providers, insurers, regulators, and policymakers, as well as a broader societal conversation about how we value health, innovation, and human life.